So we're going to talk about working in the hip. I do work in the hip quite a bit with the tissue exposed, with lotion working directly on the skin, but a lot of times I end up working through the drapes. I kind of use whether or not the person takes their underwear off as an indicator, but you can always ask, if someone has a preference. So I'm just going to work through the drapes for class here. I don't honestly think it makes a huge difference in the hip with the type of work that I do, but it just depends on your flavor there. The first thing we're going to do is get some more practice with this fifth metacarpal head. It's one of my favorite tools anywhere in the body, but it works really well for the hip, and it's a lot easier than me coming in and trying to dig with my thumbs, whether we're talking about glute medius, which is one of those muscles I think we ignore when we shouldn't a lot. We're trying to get in and press into piriformis with the thumb or something like that. That can be a lot of pressure and not as easy on my hands. So head of the fifth metacarpal, that same little rolling technique that we were doing on the paraspinals can be used in the hip really easily. I tend to make a little figure 8 or Q kind of shape where I'll start up here on glute medius along the ilium, and I'll walk kind of along the ilium and then down the edge of the sacrum, that lateral border. There's a ligament between the sacrum and the ischial tuberosity, the sacrotuberous ligament, and so I'll kind of track where that runs down towards that ischial tuberosity, and then I'll work my way out through glute max back up to where I started. Then I usually make a little slash through the center of the hip to get down and work those deep six and piriformis muscles. So I cut through that circle, moving. As much as possible, I want to move from my legs, not from my arms. And depending on what the problem areas are and what you find, you may spend 4 or 5 minutes working a hip with the same technique. If 2 hands feels less comfortable, 1 hand works just fine for this. I usually will stabilize the leg if I'm working with my left hand on this side of the table. I kind of like getting a little bit of that ABA deduction in the hip with the rock. So if you hold the leg kind of still and move the body away, you get a little movement in there. I find that working the glute area with a knuckle tends to feel less kind of grabby than using other parts of the hand, though I work with the biciform and with knuckles and both, whatever works. If you're working and you're using your dominant hand or on this side of the table, you can stabilize with the other hand or just have contact here in the low back. It usually feels pretty good. Is that pressure okay? The trick here is keeping the shoulder and the elbow down and moving from your legs. This is a big part of the body. We're moving our center of mass and we're moving their center of mass. And I don't want to just do that with my arms, especially if you're working on those linebacker folks that are just monstrously large. You really want to use the legs. Easy peasy. There isn't a requirement to follow that little pattern that I was talking about at the beginning. If you're working on somebody and they have a lot of trigger points up here in glute medius, you can just park yourself there and spend quite a bit of time without any trouble. Another area that I end up working quite a bit is the quadratus femoris, which is kind of at the bottom of the hip here laterally. So it runs between the ischial tuberosity and the greater trochanter here. And it's one of our deep six lateral rotators that gets ignored a lot. I find a ton of trigger points in here. A lot of times people think they have a hamstring problem, and it's actually in here in the QF. So that can be worked with that same knuckle. Either hand, doesn't really matter. A lot of times what I'll end up doing is static pressure instead of rolling for that. So I'm just using that same knuckle. I'm pushing my body forward to create as much of that pressure as possible. My preferred way to do it is actually with some movement, not necessarily of my hand though. So what I like to do is, you're helping, stop. I like to find the landmarks and place that knuckle in the belly of that QF, apply my pressure, and then roll the greater trochanter back and forth underneath my knuckle. So I can feel I'm working essentially the whole length of that muscle while I lengthen and shorten it. And you can reposition that closer or further from that ischial tuberosity. This doesn't take any force, you know, I'm just gently moving the leg. That can be done with any of our rotators. So I can be up here and working in the center of the hip where piriformis lives. I can apply that pressure through the knuckle and then utilize that same rotation back and forth.
Can you still get the same without rotating the leg like that? The reason I ask is I broke my left knee several years ago, and I can't rotate my knee left and right. If I do, it kind of pops.
Sure.
So for me, that movement would be terribly uncomfortable. So can I still get? I mean,
you can absolutely still work those muscles. You just won't have the ability to lengthen and shorten them in that same way. But that's okay. Yeah.
I have a client who cannot do it, and I don't know, but I lower his leg like really, and I just like add slight movement. Is that okay?
Yeah. Anything from not moving it at all to really torquing it as far as you can get it is fair game based on the person on the table.
Yes, that makes me grimace. Why can you do that?
This external movement of the ankle is actually internal rotation of the hip. And that stretches all of the deep six and glutes. And so that's a really good way to stretch it as long as their leg can tolerate it. So I often spend a fair bit of time rolling or static pressuring with that foot hooked and pulled out. As long as it's okay on the person. If someone's had a hip replacement, don't be doing this to their hip. You know, if somebody's had any sort of, you know, knee surgery that's painful, don't force it. But it's really nice on those muscles. And I'll do the opposite. I think shortening is equally as important to lengthening while you work. Some folks will tuck the knee out and hold this leg across to come in and work. And that's fine too. If it'll stay put, you can work with both hands. A lot of people love to throw their legs up on the table. I don't tend to do that. My table's too high. And I just use a hand, but that would work as well. Nothing wrong with that. Again, as long as their hip and knee can tolerate it. You're really not going to like the waggle then.
Oh, God.
That's one of my favorite things to finish up the hip with when I'm done.
That's awful.
Don't do that on Teresa. I've never had anyone complain, but I don't try to do that on people who've had injuries or surgeries to those areas. You know, some common sense goes a long way. So using that fifth metacarpal head, you can make the little Q through the whole hip. You can work down on the quadratus femoris, work in piriformis with static pressure or rolling and get that leg moving if it's comfortable on the person. All of that can also be done with the olecranon. Again, this table's a little lower than I would want for my elbow use, but I'll bend my knees for today. Using the elbow in this area can be done with or without that leg movement as well. And it can be static pressure, which is fine. Often I will do a little rocking motion with that pressure as long as it's comfortable. That's okay. The jostling is fair game as well. You know.
It's amazing how much just the jostling really affects what your elbow does. Like,
Sure.
you can really feel it.
Whether it's static, whether it's moving, you know, playing around with working more close to the medial border, working more glute medius, glute minimus up high, that QF, the elbow is wonderful for as well. Come in and stabilize and move this back and forth. If you want to get really fancy and you're not working on Teresa, you can place that elbow where it's going to be, stabilize the foot, straighten that one leg, pick it up, release. Is that too much? And then if you want to get really fun, you can move it around. Teresa's going to pass out. So the elbow is fair game, all of those same muscle areas. I don't tend to make that same pattern, but I do work all of those areas essentially as I move through.